So we presented data from the MOST study. This is a study that looked at natural history for MPNs. The progressive disease and myelofibrosis typically associated with increased fibrosis, worsening anemia, increasing circulating blasts, and leukemia transformation is often a fatal event in patients with myelofibrosis. And there is really not much real-world data looking at disease progression among patients with myelofibrosis. So we tried to look at this question in the MOST study, which is the myelofibrosis and essential thrombocythemia observational study. The disease progression was defined as physician definition, or if there was if there was leukemia transformation. The MOST study had different cohorts, ET cohort and MF cohort. So this obviously looked at the MF cohort. To be included, patients had to have a diagnosis of myelofibrosis. We looked at the patients that were low risk or intermediate risk only by age. And we looked at the disease progression and leukemia transformation. So among 232 patients, 204 were included in this analysis. Around 59 patients had disease progression, and around 15 of them had a leukemia transformation. We tried to look at the baseline characteristics. Interestingly, a larger percentage of Black patients had progressive disease compared to white patients. Compared to the patients with no disease progression, patients who had disease progression were older, as expected, and less likely to be employed. Most of the disease progression were either change in the spleen or hematological parameters, as mentioned. There was no difference in the or significant difference in the symptoms of patients whose disease progressed during the study versus those did not at the time of enrollment. More than half of the patients with and without progressive disease had MF treatment. More of those with progressive disease were receiving ruxolitinib treatment. A higher percentage of patients receiving ruxolitinib treatment at enrollment had risk factors for disease progression. So I think this is one of the first real-world data looking at disease progression pattern. Almost 1/3 of the patients had physician-reported progressive disease during the study, including leukemia transformation. Again, the symptoms seem to be similar in those patients that had disease progression or not. Patients that had disease progression tended to be older. We observed more disease progression in Black patients. Higher percentage of patients that were progressing received ruxolitinib, again reflecting some of those high-risk factors at baseline. And future analysis will focus on molecular and post-baseline data to provide insight on the causes of this disease progression.